All right, so to another health story now. Sexually active women who are not on birth control and looking to get pregnant should stop drinking alcohol. That is the latest recommendation from the CDC.
The report sparked widespread reaction from not just young women, but also from those within the health industry. CBS News medical contributor Dr. Phillips is with us now to walk through these latest findings. Thanks so much for being here.
Happy to be here, too.
So a lot of mixed reaction. What is the CDC saying based on this report?
Right. You know, there was a lot of pushback against their big headline, but I think this is really a case of best laid intentions, right? They had great intentions, but somehow the communication just didn't come off as they wanted it to. Essentially, the CDC is not saying anything it hasn't said before. They've always taken a hardline stance, at least for the last several decades, and they say no amount of alcohol is safe during pregnancy, at any point during pregnancy. So here they're taking it a step further, just to remind women that pregnancy doesn't start the moment you discover you're pregnant. Pregnancy actually usually starts several weeks before, sometimes up to 6 or even 8 weeks before. So if you're drinking during that period of time, you are exposing your fetus to alcohol.
So then, to be clear, because people were upset, they were like,
Right.
Don't tell me to put my wine glass down. To be clear, there's no difference in terms of recommendations here. The recommendations are the same in regards to pregnancy and alcohol use.
They are, but really what sparked the CDC to sort of make a very clear statement about women who are sexually active and not on contraception was to say you could therefore get pregnant. There's no surprises there. But it was really to then remind women, if you do become pregnant and you are drinking alcohol, alcohol can affect the baby at the very beginning stages.
Who is most at risk?
Right. So what was interesting is that they did a survey that really sort of kicked off their statement in their report. The survey found that 3 out of 4 women who are actively trying to get pregnant right now, who say they want to get pregnant as quickly as possible, continue to drink alcohol. So just that finding itself, the CDC said, you know what, we really need to remind women that this is still an important time during pregnancy and alcohol has effects. In terms of what they found with their survey on the entire population of women, they looked at women ages 25 through their 50s, or early 20s rather, through their 50s. They found women between the ages of 25 and 29 who are married and cohabitating, who've already had 1 child, and who are smokers are more likely to drink alcohol during pregnancy.